everyone, it's Nurse Angie again. So today, on behalf of Nurses.co.uk, I just wanted to share with you guys the journey into becoming a school nurse and talking about the course you have to do in order to specialise in this area. Now, a lot of people have a perception that being a school nurse is boring, it's easy, when in actual fact, it can be incredibly challenging. Like, we are essentially public health practitioners. We combine working in safeguarding, health, mental health, well-being, all of that together to provide an early intervention service for school-aged children up to around the age of 19, depending on your trust. You know, we have our own caseload, and actually we are autonomous workers. We work autonomously in the community. So if you have an interest in working with children and young people in a public health setting, or hopefully, you know, you're thinking about in the future, you might want to switch over from acute to community, school nursing, health visiting in the future, then this might be of interest to you. So currently, I'm coming towards the end of my postgrad studies in what's called a Specialist Community Public Health Nursing course. And you may hear it shortened to its abbreviation of SCPHN, and that's what I'm going to be calling it throughout the rest of this video, SCPHN. So I finished in about 4 weeks, so I'm coming towards the end now, and I am so excited. I can't tell you. Breathe, guys. We'll get into it. So the SCPHN is essentially a 1-year course, and you can take it at a level 6 level or level 7, and that's essentially a degree or master's level. You have to be able to be a qualified nurse in order to do the course, and there are 2 routes to choose from. So you can do a health visiting route, and you can also specialise in a school nursing route, which is the route that I've chosen to do. So the SCPHN is 50% based at university, so your lectures, and also 50% in practice in your chosen route. So for example, if you've chosen to do the health visiting route, then your settings will be in relations to where under 5-year-olds will be, like, you know, health centres. And if you've chosen to do school nursing route, then your practice placements will be in schools, and that will be both primary and secondary, and sometimes PRUs, which are pupil referral units, if your locality has any of those. You will be assigned what's called a practice assessor, who is essentially like your guide throughout this course, and like your mentor, basically, so to speak. So it's important that you have good working relationships with your PA, and practice assessors is shortened to PA. So they'll be the ones assessing your portfolio document. We get given like a document to complete throughout the course of the year, and your PA is the one who's responsible for either passing or failing your placement, basically. You need to pass both elements of uni and practice in order to get your qualification. So let's start with the university side of things. Guys, I really struggled with the academic writing again. I'm not even gonna sugarcoat it. Luckily, I passed everything first time round, but for me personally, it had been 12 years since I'd been to university when I started this course last year. So, you know, as soon as I heard things like Harvard referencing system, I started getting palpitations, and it all came flooding back to me, like all my pre-reg nursing stuff. So if, like me, you hadn't been to university for a very long time, try and get reacquainted again with things like assignment writing, Harvard referencing systems, all that kind of stuff. And actually, I find it quite helpful to dig out all my old assignments on pre-reg nursing, and also speaking to friends, speak to your colleagues about who have done the course before, to get an idea, to get some tips on what the course is going to be like. If I'm honest, I've never really heard of the SCPHN before until last year when I applied to do it. And that's only because most of the school nursing services that I'd worked with previously didn't offer it. So it was not really something that came up in discussion in order to be made aware of it. It's essentially a qualification that more and more recruiters and trusts are looking for if you want to progress in your career and your banding in a public health setting. So more trusts will require you to have a SCPHN qualification if you want to be a band 6 or band 7 management kind of level. So if you're a nurse that sees yourself progressing in the future into sort of more leadership roles, then you will have to find that you may have to complete the SCPHN course in order to do so. Most people will tell you that this is the hardest course that you study, and that's purely because of the intensity of it. I'm not going to lie, like, you're essentially squeezing in a 3-year degree into a 1-year course, basically. So if organisation is not your friend, guys, make it your best friend from now. So let's talk about the modules. So the modules that you'll be studying on the course, and it's important to note that obviously whichever university you do the course with might do sort of slightly different, but the core modules should be essentially the same. So the modules are, there's a research module, there's a primary state of the child module, there's a public health one, there's a leading SCIF and teams one, and a managing SCIF and teams one. So if we're talking about our research module, first of all, this is essentially learning about research behind health, behind school nursing, behind health visiting, and you'll be given like 1 or 2 research papers that you have to critically analyse. That was another word that I had totally forgotten about that really hit me in the face. Critically analyse the research papers that you've been given. You'll have to discuss it, your pros, your cons, and this is where all that qualitative and quantitative wording comes into it. So yeah, that's the research module. Your primacy of the child module is essentially about putting the child first in the centre of care. And this module looks at things like safeguarding, your domestic violence, your child health, health and well-being, mental health elements as well come into it, and looking at legislations, law, policies around children and young people. That's a really exciting module. I really enjoyed that one. Your public health module is pretty much self-explanatory. So you're going to be looking at public health in regards to children and young people. You're going to be looking at things like obesity, profiling schools, international public health even is discussed as well. So depending on what your uni you do your public health at, you will be given a project maybe. So for my university, we were given a project, and that was to design a poster on a public health issue that was currently a concern. So that's an exciting one to do. And one thing to say actually for this course, that you need to pass both elements, so both the university side and the practice side in order to pass the course. If you fail one, you won't be able to progress. The leading SCIF and teams module and the managing SCIF and teams module looks at how us are going to be the future leaders in regards to public health settings. So it gives us knowledge and skills on how to manage, how to lead teams, looks at leadership styles and approaches and attitudes to leaders, and how actually that can impact either the team or it can impact patient outcomes. And I really enjoyed this module as well, actually. And then obviously you've got your placement days in between. So typically the course is set out as 2 days uni, 2 days practice, and 1 day study day, and that should be the same throughout the course. So it kind of gives you an idea of what to expect if you're looking into applying. If you're a parent like myself, I'm not going to sugarcoat this. Please be prepared to utilise all childcare, all family where possible, because it can be quite stressful juggling parenthood, juggling university, and juggling placement. But it doesn't mean it's impossible. I mean, when I started, my daughter was 4. She's now 5, and I'm just 4 weeks away from finishing. So if this is something that, you know, potentially is putting you off in terms of family life, please don't let it put you off. You know, you can do it. You know, like I said, I'm almost finished. I've done it. Dedication, organisation, calling on help where you can. And I'm certainly not the only parent that has gone on to finish this course either. So guys, it can be done. When you complete the course, you'll have an additional title inputted on the NMC register. So as a specialist public health practitioner, so that will go on the NMC register under your name alongside what your initial qualifications were. So for example, if you have children's nurse on the register, adult nurse, so you'll have two lines, which is quite exciting actually. And you can take your public health qualification anywhere in any related setting. So be creative with what you want to do with it afterwards. You know, you can go into schools, you can go into health centre, you can go into safeguarding, domestic violence. Like, the world is endless. So I really do champion this course. I'm really happy and I'm glad that I took the plunge and I studied it. I'm always at the end. I'm excited for the future. And this is definitely something that you want to get into, then by all means, please look into it. So yeah, I hope that was of interest to you, and I will see you next time. Bye.